Good morning, good afternoon, good evening, wherever you're watching me from, my beautiful nurses. Thank you so much for coming back, watching my YouTube videos. I'm back with another topic. My name is Saima. I'm a nurse and I work in the UK, currently practicing in the UK. So today video we are going to talk about my experience when I joined the NHS as band 3. So it's quite interesting. What was my story? Stay tuned if you are interested to watch. All right. First things first, I would like to say that I'm going to talk all about. I'm going to talk everything about my experience only. Everybody has a different experience, every department is different, every organization is different, so whatever I say will be depending on my experience. I can't say for other organization, I can't say for any other department. Even in my hospital, I can't say anything about the other department. So everything I'm gonna talk about will be on my experience. All right, so I came to the UK in 2020 and I joined as a band 3 nurse. When you are overseas, you join the NHS or UK as a nurse, you joined as band 3, and then you do your osce exam and then you become a band 5, as you all know, right? So when you come as band 3, it's quite interesting. Every department is different, as I said. So that time it was a COVID time. It was COVID everywhere, and the department I joined was medical surgical, and it was a very busy shift. On my first day I was introduced with everybody, all my colleagues and the doctors, the nurses, healthcare support workers, managers, and it was a good introduction. We took the handover early morning, 7:30. You start the shift at 7:30 and finish at 8 o'clock. All right, so it's a 12 hours and 30 minutes shift, but they don't include your 1 hour break, so you'll be paid for 11 hours and 30 minutes. Okay, so we started the handover at 7:30. So the manager, at the handover time, she told everybody that I'll be joining their team, and they welcomed me at the handover time. And then when they were reading the handover, everything was going over my head because I didn't know how the handover works. In my country it's different, here it's totally different. So what happened here, like in my country, the handover is like if there is anything pending, how many patients they have, if there is any outstanding jobs that they need to do, and if someone is going anywhere or any other department or anywhere else. The handover is basically like if anything pending, or if they want me to do anything, or if there is any medication shortage or they haven't done, so I have to do it. So it's like that. But here it's different. So when you go at the handover in the morning, they give the handover for all the patients that you have. Again, it's a totally it's different in every other department, it's different in every other organization. So in my department, how it works, like we have like 30 patients in the ward, so they'll give the handover, the big handover at 7:30 for all of those patients. But I know in some other wards what they do is they give the handover as per team. Like let's say I'm in team 1, I have 10 patients, so the night nurse, she'll give me handover, she will give the handover for those 10 patients, and then the next nurse will give the handover for the next 10 patients for team 2, like that. But in my ward, what they do is they give the handover for all 30 patients, for each and everybody. And then everybody who comes on the shift, all the nurses, the support workers, the nurse in charge or the manager would stay there and listen the handover. Okay, it usually take like 30 minutes. So we were doing the handover. We finished the handover at 8 o'clock, and after that you start your shift. So how the handover works, like we got this patient, let's say I'm the patient, they say, so Saima Nadeem, 80 years old, came in with this, have previous history of this, current diagnosis, and then any infection, what is their mobility, what is my mobility like, what is my eating habit, eating pattern, or if I'm on halal diet or normal diet, or if I'm independent, my mobility, as I said, or continent or not incontinent, and what's the plan of discharge, like that. So for each and everybody, they're gonna say all the handover for 30 patients, right? After the handover, they give you assignment. So that was my first day of joining the trust, and then they usually what happen is they assign you with a support worker. So healthcare support workers are band 2. They help the nurses with the daily chores, everything, with the washing, feeding, and all of these things. All right, so they assigned me with a healthcare support worker, and then she took me with her, and then she told me, okay, let's start the washes. And then we had 10 patients, team of 10 patients, and then we started the washing. So from morning 8 o'clock till 12, we were just washing the patients, right? Each and everybody, we washed everybody. And then you also need to, there is intentional rounding, called intentional rounding, like every time you see the patient, you write it down. So for those 10 patients, you need to write it down, how many times you've seen them, and what have you done, if they wee, if they passed urine, if they passed urine, same thing, or if they open bowels, or if they can eat by themselves, if they walked, or if we turn them. So each and everything we document on the intentional rounding. So we finished the washes at 12, and then we had to do the paperwork as well. Anyways, we did the paperwork. So what happened is, when you join as band 3, sometimes the support workers are really helpful, but sometimes you can get the opposite ones also. So what I noticed that day, I mean, it was my first day, I didn't know much, and in my country also, like we don't do washes, the assistants they do, or the relatives they do. So it was quite new thing for me. Anyway, she told me for one patient, how do we wash, how we give the bed bath, or how we give the bed bath, and how we turn the patients. I knew how to turn them, but it's they use a different method here. So she told me for one patient, and then every now and then I couldn't find her. Where is she gone? So it was quite disturbing for me, like every 5 minutes I won't be able to, I was not I was left alone in the room, or with one patient or two patients. So being a new nurse and without any support, it can be quite challenging. But don't worry too much, because you are new there, you don't know everything, and you shouldn't know everything, because it's your first day. So how are you gonna know, right? So every now and then I was looking for her. And then she said, you don't need to look for me, you can just continue your work. And I was like, it's my first day and I don't know much. I mean, I can the way you told me to do the washes, I can do it, but every patient is different. Sometimes it's assistance of one, sometimes they are assistance of two. So she was not happy that I was looking for her. They said every person is different, every healthcare support worker is different. Sometimes they are very helpful, they are very kind. She was very kind, we are good friends now. But that day, I don't know, maybe it was my, like, I was a bit overconscious or nervous, because first day, you know, joining any department or your first job, first day can be quite daunting. So the next thing, the weird thing happened was, so that was the first thing I'm telling about the washes and everything. So the next thing that weird happened was, she asked me to do to empty the catheter bags, and I didn't know how to do it. Honestly, I would be honest, I didn't know how to do it. And then because the catheter bags here, they are different than back home. And then she said, I said to her, I'm so sorry, can you please tell me how to do it? And she said, of course you know how to do it. And I was like, I don't know, can you please tell me how to do it? And then she told me how to do it, and then she asked me to empty the catheter for each and everybody. So okay, I did it. The first day, you're gonna listen to everybody, whatever they say, all right? Even it's a sport worker, even it's a cleaner, even it's whoever, a housekeeper. So I was very good. I said, all right, that's fine. And then after that, we served the meals for the lunchtime. It was lunchtime, so I helped them with the serving the tray. So what happened is, with the meals, they give they prepare a tray, they put all the things whatever patient order, or the meal, and then the housekeepers from the kitchen staff, they give you, and then you take the tray to the patient and give it to them. If they can feed themselves, very good. If not, you have to feed them, right? So I help them with the meals, and whoever needs help, we did that. And then we documented what they ate, how much they ate, and if someone didn't eat, we need to tell the nurse, right? So we did that. It was already afternoon time. And then after that, the daily routine, I mean, it can be quite difficult to consider that 12 hours shift is so long. I mean, on the first day, because I used to work as like 8 hours or 6 hours. In my country, we do 6 hours, but back in Dubai we do 8 hours. So I used to do 8 hours shift, 8 hours a day, so 12 hours was quite long for me. And then around 1 o'clock, I was already tired, thinking that when can I go home? And then when you feel like that you're done for today, you can't do anymore. I mean, my legs were hurting, and for them it was just a routine, because they used to do it every day. For me, it was first day, and doing all these things like washing and turning them can be quite difficult. I was having pain on my arms and legs walking too much, right? So it can be quite difficult, it can be tiring, but don't worry guys, like after a few days you'll be fine, you'll get used to it. So the funniest thing I remember even now is when I asked her, I don't know how to empty the catheter, and she said, of course you know. I started laughing immediately when I heard that, but you know, she was serious. She was not in a funny mode or something. So I just turned around and then face myself towards the wall, and I just, you know, tiny bit laugh in my mind that I don't know how to do it. Honestly guys, the catheters that we use in my country, they are different than here, so I didn't know. I will be honest, I didn't know how to do it. So that time I felt bad also, that she's asking me to do the catheter. And because when you come from your country where you don't do washes, you don't empty catheter, you don't wash their bums, you don't clean their bums, it will be quite different for you. I mean, totally different and embarrassing. It feels weird. It feels weird, honestly. It feels like, is this what you're going to do for the whole of your life? Washing them, taking them to the toilet, waiting them outside the toilet when they come back, and you will clean their bum and take them back to the toilet. Nothing, I'm not saying anything negative, all right, but this is what we do. I'm not I'm not saying that just to give you negative vibes or anything, but it's truth. It's true. That what it's a fact. That what we do. All right. So for me, it was totally different, waiting outside the toilet for the patients to come out, and then you will go inside, wash their bums, and give them pad, put their panty on, and then take them back to the room. It's quite common here. We do it every day. Even I'm band 6 now, but as a supervisor also, when you don't have nurse or support worker, you will be there to help them, right? So after the lunches, we did the paperwork again, and then for them who are 2-hourly turns or 4-hourly turns, we need to make sure that we are doing the turns also. Then again, it was like every time someone ring the buzzer, you need to go there, ask them what they need, what happened, or because here every patient has a buzzer on their bed. So if they need a nurse, they'll press the buzzer. You go there, answer the buzzer, and ask them what they need, and if they need to go to the toilet, or if they want a drink or something like that. Okay, so this is how it works. So again, around 5 o'clock, 5:30, dinner time. Again, you get the dinner, serve it to them, and help them if they need feeding. Then you again, before you finish your shift, you check the pads again. Every now and then you need to check the pads for them who are incontinent, who don't know, who can't tell that they need to wee or open the bowels, so you're gonna check their pads anyways. Well, so that was my day as band 3, and that was the horrible day I've ever worked in my life. When I came to the UK, I already had experience, like a nurse experience for 2.5 and 3.5, so almost 5 and 6 years experience. I already had 6 years experience, and then in that 6 years of experience, I never worked that horrible. I mean, I never worked that hard or difficult shift. So I felt like it's too much. When I came back home 8 o'clock, I called my husband and I said to him, I'm not going to go back. Honestly, book my ticket now, I'm coming back home. And he was like, okay, calm down, did you eat anything? He's so calm. I mean, he didn't say anything to me that time, and he just said, okay, did you eat anything? Have you had a shower? And I was like, okay, I'll call you back. I took shower, I ate, and then I called him back, and then I said the same thing again. I'm telling you, I'm not going to go back to work again. So he said, okay, that's fine. Don't worry too much, okay? And then I cried also, because it felt so bad. And then it was so busy, very tiring. And there was nobody here from the family also. I was alone on top of that, and everybody, they just pass by and say, are you okay, but they don't really mean it. They just say it as a way of saying. And that time when you feel like they're asking you if I'm okay, and then you want to answer, and then by that time you look around to answer and they're not there. So everybody whoever pass by say, are you okay, or you come around, when you turn around to answer, there's nobody there. So it's just their way of saying that if everything is all right. I felt really bad. And then with that sport worker also, with the washes, with the emptying the catheter, and personal hygienic care, and so many things on the first day. I think it would have been best if they told me, like, this is the routine and this is what we're gonna do, and then instead of putting the band 3 with the sport worker on the first day, I think it's good for the ward, for the department, to put the band 3 with the nurse, because that's what they're going to do, not working as the sport worker only. That's what I think. And then maybe because of the COVID time, they didn't have anybody, and then they just put me with the sport worker. But it happens, even now it happens, like, but in our department there are so many changes have happened, and everything is changed now, and it's quite good now, so I'm not worried that much. And I can, for the newly coming nurses, I support them wherever they need, especially on their first day. I don't want anybody to have bad experience. So as supervisor, as in charge, I try my best to put them with the nurse instead of putting them with the sport worker. They need to, the band 3 nurses also, they need to learn. I understand that they need to learn how to do washes, they need to learn how to give bed baths, but they will learn eventually with the time. I mean, before giving their osce exam, they have 3 months or sometimes 2 months, so they would learn. It's not like they have to do everything on the first day, because I think for the first day they should have a good experience, so they'll be happy to come back the next day, instead of pushing them to do each and everything on their first day. It's not nice. So what I do is I try my best to put the band 3 with the nurse, so she can follow her, she can see the routine, how the nurses work, what is their routine, what they do on day-to-day basis, and what they will be doing in the future. So this was my story. But honestly guys, whatever happened on the first day, my husband was very supportive. He said, okay, you go back to work in few days, in 2 or 3 days you'll feel much better. Second day it was not that bad. Second day it was all right. They put me with the nurse, and then she told me how to do the things, how to do the medications, how to take OBS and blood sugars and all those things. She did, because the BP monitoring is the same, the machine is the same, glucometer is a totally different thing, ECGs are different, so you need to learn those things also. So she taught me how to do this one and that, and medication and each and everything. I felt better on the second day. It's now 2 years, I'm still here. I'm not telling you these things to make you feel like you don't want to travel or you don't want to go there. I'm just telling you the fact that it can happen. But if it happens, you don't need to worry. You don't need to worry. It's not gonna stay like that forever. After you get your PIN, you will be working only as a nurse. You will be doing your stuff first, then the hygienic care and all those things. Okay, and this was my experience. Everybody has different experience. I know nowadays, like we getting band 3s, and we try our best to give them the best experience ever on their first day. I take them with me. I make sure that I give them orientation to each and everything, give them a ward round, put them with the nurses, and show them around what they have to do, how they do it, how each and everything works. Okay, so this was all about it on my first day. And don't worry, don't get scared, still apply for it, go for it, and after you will get used to it. When you are you're a nurse, when you get your PIN, you won't be doing all those things for the whole day. Okay, you will be doing it, but for some time, like if they need assistance of 2, or if they need any help, if the sport worker needs your help, then only you will be doing, but not for each and everybody. Okay, you will have your own tasks to do before you do the healthcare sport workers task. And everybody knows their job here. All the sport workers also, they know their job, and if they don't know, you are the nurse, you will be telling them what you want them to do. All right, so later on I got settled. Within, like, after second day I was all right, third day I was all right. But it can be, when you come from home, it can be quite tiring. Honestly, it can be tiring, it can be difficult with the adjustment to the environment, with the colleagues. And I'm a bit shy also. I was a bit shy in the beginning, and mingling with each other can be difficult also. So in the beginning there are few things that you need to it always happen, like wherever you go to work on the first day, you can feel that like adjusting to the environment. You will be the one to adjust to the environment, or with your colleagues, make friends, talk to them. If you are hesitant, if you are not sure about anything, always ask. Don't do it, okay? If you're not sure, don't empty the catheter if you don't know if you don't know how to do it, okay? There is no NHS, they never ask you to do everything. They never ask you to do the thing that you don't know, okay? If you don't know, just tell, I don't know how to do it. Just say it, okay? And then they will tell you how to do it. They'll teach you. It's really good thing here about working in the NHS is that they always say how to, they always tell you, they always teach you, they always give you trainings how to do it. Sorry, they always give you guidance, lectures. There are classes, online classes, virtual or face-to-face classes. They do the classes on turning the patients also, so you don't hurt your back. So it's not that you will be doing everything when you come here. All right, so don't get scared, always ask. And that's it, guys. That was my experience. If you have had any bad experience, let me know in the comment section. And how did it go afterwards? Did you leave the job or you stayed? So let me know. I'll be more than happy to see your comments, to read your comments. And if you have any questions, if you are worried about anything, let me know in the comment section, okay? And this video was not to make you feel bad or to make you feel worried, all right? These things happen in everyday life, all right? But with the time, as the time passes, you will get used to it, okay? Take care. Thank you so much. I'll see you soon in the next video. Bye bye. Love you all.